Hi, thank you for having me. Dr. Narjust Florez. I'm a thoracic medical oncologist and the Associate Director of Cancer Care Equity at Dana-Farber Cancer Institute and an Assistant Professor of Medicine at Harvard Medical School. On top of that, for the last 2 years, I have been the co-chair with Dr. Martin, Dr. de Moraes, and Dr. Patel for the 50th anniversary of IASLC at the World Conference on Lung Cancer. It has been a 2-year journey, but we have actually changed so many things about the conference, and we want to have a patient holistic approach. And all started with the workshops. We have workshops dedicated to compassion fatigue. We have workshops dedicated to early stage, to surgery, because IASLC is the only international society that is multidisciplinary, and we all have the same objective, which is cure thoracic malignancies as we know them. So let's start. So Saturday we had the workshops is early 8:30 in the morning, 12, 2 p.m. And then last night we have the opening plenary. The opening plenary was something that included the perspectives of the NCI Deputy Director. We have El Director del Instituto Nacional de Cancerología from Mexico City. So we had the perspectives of Mexico and the US when it comes to lung cancer, and we closed it with Dr. Wynn, who focuses on cancer health disparities. We also had a tribute to our patients advocates that are not with us anymore. So what to expect today? So right now, early in the morning, we had the highlights of the day. We have our first presidential session today, and for the first time at the World Conference on Lung Cancer, we have 2 presidential sessions, so today and tomorrow, where we're going to have groundbreaking data that will impact the patients with lung cancer worldwide. What else to look for? So we have for the first time a wellness lounge, which is a quiet place in which people can have refreshments all for free. You can go there and decompress for a very busy conference. We also have the wellness challenge. I can tell you it's so competitive right now. There are people with like 80,000 steps a day. Are people taking CrossFit classes? Are people going and runs at 4:30 in the morning? You can find more competitive people. On top of that, all the funds that are collected to the Wellness Challenge go to the IASLC Foundation. And lastly, for the first time at the World Conference on Lung Cancer, we have a merch booth. Feels like a concert because we're celebrating the 50th anniversary. So don't forget to get these very cool merch celebrating the 50th anniversary. It has been busy, but it has been rewarding because we have changed this conference to be more inclusive, to include the patient's voice, and to include the voices of our colleagues worldwide. And multidisciplinary, we had the largest number of radon surgeons that we ever have in this conference. So that's a quick summary of the World Conference on Lung Cancer 2024. So since its inception 50 years ago, IASLC has been an international society. That's the first word, right? The International Association for the Study of Lung Cancer. At the beginning, it was challenging, right? Technology wasn't there. It was hard to connect. And after the pandemic, it was like a little disjointed. We were together but apart. So we really put a lot of effort because this is the first conference in which we didn't have a contingency plan for COVID. So we were able to bring people from all around the world. We were able to bring our colleagues from China, from Japan, now that the restrictions have been removed, because lung cancer is an issue globally. We have colleagues from Australia, and we have the largest representation of Latin America ever at the World Conference on Lung Cancer. And that's very important to me as a Latina and originally from Latin America, because everyone's voice matters. And we want to have them here. We want to learn from them. And because we're always better if we work as a team, and we're always better if we learn from others people's life experiences. We have 3 different presentations for the Florez Lab. First is the mini oral presentation tomorrow or Monday that will discuss lung cancer screening in vulnerable populations from the Cancer Care Equity Program at Dana-Farber Cancer Institute. Thanks to this intervention, we have increased significantly the lung cancer screening in vulnerable populations, which are Black and Hispanic patients in Boston. And this has go up to 85% completion rate for lung cancer screening to the patients that met with us. Furthermore, this is the first time we are presenting the data about the pregnancy and lung cancer registry. we at the Florez Lab in December last year created the first registry about lung cancer in pregnancy, and we're going to have some of the early data presented as a poster. The last thing for the Florez Lab is our prospective evaluation of gender difference for immune-related adverse events. This is the second time we're providing data. This is a longitudinal assessment of identifying sex differences in tolerability and side effects of immunotherapy. So I want to invite everyone who is far or is close to check out the mini oral presentation about lung cancer screening in vulnerable populations, the poster about lung cancer and pregnancy, and our poster about gender differences in immune-related adverse events. Despite being the conference chair, the Florez Lab is where my heart is, and I want to invite as many people to stop by. They're very young, brilliant minds presenting this research at the World Conference for Lung Cancer.